with a crossword.
Okay, no, stop.
Okay. Hi. Nice to see you. Are you folks ready?
Ready?
Okay. Well, my name's Janine,
I'm Taylor, for anybody who didn't know.
and we are nursing students in our senior year at University of Mount Union. So today we're going to talk to you about urinary tract infections, or commonly known as UTI. You don't have to raise your hand, but in your mind, how many of you have ever had a UTI? It's not a fun thing to have, is it? So what we're going to do is we're going to go through this little pamphlet that we made and kind of give you like the anatomy, the definitions of like an upper UTI and a lower UTI, some signs and symptoms for both the upper and lower, as well as some risk factors. And then Taylor's here is going to talk about how they diagnose the UTI, the treatments that go along with the UTI, some complications if you were to have like a reoccurrent UTI, chronic UTIs, or even complications of like not having the UTI treated. And then as well as some prevention measures that you can kind of prevent the UTI from even happening. So if you have any questions, we will be happy to answer them after the presentation. And then there is also the little packet that has like the little kidney. It kind of shows how it's filtrated through the body and then goes to your bladder as urine. And then there is also a word search just for fun. So in this little picture here, it shows like the basic anatomy. So what happens is our kidneys are a huge filtration system. That is its number one job, is to filter our blood to get rid of any waste that our body cannot use or can cause damage to it. So what it does is it filters the blood and puts that waste into our urine. So we have two kidneys. Well, most people have two kidneys. Some people are born with one or have to have kidney replacement and stuff like that. And then we have two ureters, or some people can have one, which facilitates the transport of kidney or the urine from the kidneys to the bladder. And then you can see in this diagram here that a woman's urethra, which is what allows us to void out the urine, is much smaller than a man. And you will learn that women have a higher risk of getting a UTI just for that reason, because you have a smaller urethra. So, some signs and symptoms. An upper UTI would be more up in this area, and they will have different symptoms as a lower UTI. So some symptoms, and some of you may have had these symptoms when you had a UTI. Discomfort urinating. So it can be that burning when you go to the bathroom. Difficulty urinating. You feel like you have to go, but it just won't come out. Urgency and frequency. You have to go often. Pelvic pain, abdominal pain, and you can even, it's common to have blood in your urine as well. Some signs and symptoms, not limited to just upper, but a fever. Increased white blood cells, which in your urine, which Taylor will kind of talk about. You may even hear your doctor say flank pain. That's like back pain. It would be like up in this area where your kidneys are located. And then also nausea and vomiting, and pain above your pubic area. You can also have pain there. Now, don't be worried if some of these symptoms sound like what you're having now, because some of these symptoms occur in the aging population. You'll have frequency of urination and urgency. But a big sign or symptom of UTI in the aging population is confusion. A lot of people think that is a normal state of aging, and it can be just as simple as a UTI. So So now we're going to talk about some risk factors. Like I said, sorry ladies, but female gender has a higher risk of getting a UTI compared to the man, just because the urethra is so much shorter. It allows for bacteria, if it gets in that area, to move up quicker. But men, enlarged prostates or even kidney stones can block off the flow of urine, and it can leave it stay in that spot and just allow bacteria to grow. Sexual intercourse, anytime you enter anything in that area, you're introducing it with possible bacteria. Holding in your urine. You should never hold in your urine. I understand, like, let's wait till we get to that next rest stop, or there's 15 people in the bathroom. You should never hold in your urine. As well as incomplete urinating. Like, this is the time that we don't want to be in a hurry. We want to empty our bladder 100%. How many of you have had a urinary catheter? That is another thing that can cause a UTI. You're introducing a foreign object into your urethra, which can cause a urinary tract infection. Some certain medical conditions like diabetes, with diabetes you have increased sugar levels, which can be in your urine, which is just another breeding ground for bacteria. Bacteria loves sugary things. Some medication, like immunosuppression medications, once we suppress the immune system, something as simple as a UTI that our body might be able to fight off on its own, that medication is just going to suppress your immune system, so then it's going to have to fight it even more to get rid of that infection. Menopause. When I seen this, I'm like, what? How can menopause cause us to have a UTI? Well, the decreased estrogen levels increases your risk for UTIs and reoccurrent UTIs. Scented soaps and lotions and feminine products, anything that's scented or has that dye can cause irritation to that area, leaving it susceptible for bacteria to get up there. And as much as I love my bubble baths are really bad for that area as well, and it can help facilitate bacteria in that area. Taylor's gonna go ahead and start talking about some diagnosis.
So there's a couple ways that we can diagnose a UTI. The first one would be a urinalysis, which is also known as a UA, and that is when you pee in a cup and then the lab will check it to see if there's any bacteria. It's a very inexpensive test, so that's the most common. And it looks at things like what the urine looks like, what its concentration is, if it has anything in it, you can see it could be cloudy. There are white blood cells, which is an indicator if it's elevated that there is a bacteria and there's an infection going on. And the same thing with increased pH levels, because it'll be more like a basic type of pH level where bacteria can thrive in and just feed off of us. Another one is a urine culture, where the same thing, you'll need a cup of urine and it's swabbed in this little cup, and then they watch bacteria grow. And then that tells you what kind of bacteria it is, which is mostly E. coli, which we'll talk about. And then that determines what kind of treatment you'll need to get rid of it. And then in severe cases, you will need a CT or MRI, which takes a picture and looks at our ureters and our bladders and things like that, and it can show inflammation, and it can show like if there's a kidney stone, and especially with people who have recurring UTIs all the time, maybe there is a blockage that they need to look at to make sure that they can get rid of it and have the right treatment so it doesn't come back. So what to expect for the test if you do have to urinate in a cup, they like it to be a clean catch urine midstream. So you'll start to urinate into the toilet like normal, but then you'll finish into a cup so that you don't get any kind of bacteria other than just your urine into the cup. And then like we said, some people have been catheterized, so you know what that's like. So that's an easy way if it's difficult to urinate. Maybe you need the test right now and you just don't have any urine in your bladder. But a catheter will always produce a little bit, enough to get the test done. So then, and like we said, that has a risk in itself. Just by entering through your urethra, you're exposing it to, maybe there's germs on it and bacteria that could get in. So like I said, the color may be cloudy. It could be more of a deep amber color, not like a yellow, like that is a normal color to see. It could have a bad smell to it if it's bad enough. Blood is normal to see in it too. And then the white blood cell count that the lab will find out. And the bacteria that is the most common cause of UTIs is E. coli, just because that is found in our stools and it's so close to our urethras, especially in women, because you don't have much room for, like if we wipe the wrong way and things like that, you can just enter bacteria into that area. So then for treatments, the most common treatment will be an antibiotic, and everybody's different. Mostly people will get penicillins and cephalosporins, and but everyone's different, so there's just, it depends on the individual. And it's important to take your antibiotics completely, whatever's prescribed. You don't want to take a couple pills and then think that the infection is gone and then and stop taking it, because then your body has an increased risk of rejecting the medicine, and then the UTI will come back even stronger, and you don't want that. It's also important to increase your fluids. You want to drink at least 6 to 8 cups of water a day, because you want to flush out bacteria and the infection more throughout the day and urinate more, because if you drink a lot of water, you have to pee a lot more, you know. And then also a common symptom was that back pain, so just a heating pad and just resting will help a lot with that. And cranberry juice will also make our pH levels go back to more of an acidic environment, so that the bacteria can't live there anymore, and then also will fight off the bacteria from just binding to our bladder walls, so that way it can be flushed out with the urine. So then some complications of not treating it. E. coli is very mobile and doesn't take a lot for it to come up into our ureters, into our kidneys, so that can cause a kidney infection, which is a whole nother treatment game and hospitalization. And that infection can even spread further into the bloodstream, which can lead us into sepsis. So then you're finding a whole body system of an infection. And then there's also people that have recurrent infections can lead to scarring of our kidneys, and it can lead to renal hypertension and eventually kidney failure. So then people who are on dialysis, it's because their kidneys aren't filtering the blood and the urine, so we have to do it for them. So now we know things like the signs and symptoms and the risk factors and how it gets diagnosed. But the most important thing that we can always do is just prevent it from happening in the first place. And these are things that we do all the time. It's nothing new. We do it every day for our hygiene and to stay healthy. So cotton underwear and loose clothing is very good, because cotton is very breathable, and you don't want clothes that stick to you very tightly so that our skin can't breathe. You want to urinate after sexual intercourse, like Janine said. You're just introducing bacteria and germs. We're full of germs. So just by urinating right after, you just flush it all out if there was anything, so that way it can't climb up into our urethras. Women, we like to wipe front to back. You don't want to bring over anything into our urethras, like I said. And then drinking 6 to 8 glasses of water. It's very important. It sounds like a lot, but it's the normal to drink throughout the day. And then limit baths. We love taking baths. We love just relaxing and sitting in a bubble bath, but you're sitting in your germy water, basically, throughout the day, especially after a long day. If you're just wanting to take a bath and go to bed, it's good to do that, but you want to limit it as much as possible, because showers are way better, because you're just standing and you're washing, and it just falls right off your body and into the drain. And no scented soaps, like you said. Scented soaps are very good. We like to smell nice, but they're full of chemicals and dyes that aren't good for our bodies if it gets access into our urethras and our bladders. So things like just soaps like regular Dove, or just something that's like for sensitive skin or doesn't have any artificial scents and stuff like that.
To go off a little bit of what Taylor was saying about like the heating pad, applying the heating pad doesn't mean to apply the heating pad and just let it sit there for hours. You should just maybe leave it on there for like 10-15 minutes at a time, and then always have something to protect your skin from it. So like a towel or a shirt, just so that you're not burning your skin, because those heating pads can be very dangerous if they are applied right to your skin. So that we've learned a little bit about UTIs, does anybody have any questions?
Yeah.
You do?
Sometimes when you have a UTI, you don't have symptoms.
That's true.
So how do you, how do you
know
know
what it is? That's hard to answer, because I mean, even being sick, you might not have symptoms. but there's something that has changed in your body. You might be going more frequently, and it's kind of like, nah, I don't usually go 10 times a day, like what's going on with my body? If you have any of the symptoms, regardless if it's normal for you, and then something changes, you should always have that looked at by your physician, just to make sure. Because if you let it go a long period of time not treated, it can lead to a more complicated UTI or even kidney damage, which we don't want to happen.
Being a diabetic is a bad risk factor.
Yes.
That's why it's so important to control your sugars. Because if you have a lot of sugar, bacteria likes to feed off of that. Just like it would feed us, it feeds bacteria, and you don't want bacteria sitting in our ureters, in our urethras, and our bladders. If there is a chance of bacteria being inside.
I can tell when I've eaten too much bread or
In your urine, you can tell. I've heard that it smells sweeter and it's stickier.
no, it don't smell.
I've just heard that through
yeah.
people. I've heard that it's stickier, like people have been like, oh, they must have their sugars high because I went to the bathroom and it was sticky. I don't know how they
Or
knew it was
sweet smelling.
sticky, but
Yeah.
yeah.
When I'm eating too much of starchy stuff, it just automatically show up.
Yeah.
Yeah.
Do you monitor your blood glucose
Every day.
every day?
Good.
Good.
I try to do the good diet. Sometimes I get,
Cheat a little bit.
I like pizza.
Yeah.
I think we all can agree with that. Pizza's good.
I like pizza. And if I go to Red Lobster, I'm going to eat 4 biscuits.
Maybe cut back to like 3. Anybody else have any questions? Vito, you have any questions over there?
No.
No?
Okay, well, thank you guys so much for listening to us.
You have another question?
I have
Yeah, you're fine.
I have a great granddaughter that was born with kidney problems.
Okay.
And when she was, probably after she got to be about 3 months old, they removed one of her kidneys. How did they detect that she was having one of those problems?
That is a whole nother area that we've not covered. I mean, if Melinda has anything to add.
Either, it depends on what was going on even whenever they were babies. Sometimes they even know in ultrasound, like they,
Yeah.
sometimes they even know whenever the mom's pregnant that there's an issue with one of the kidneys and could have to have it removed. There's, it just depends on what was going on with her. She may not have, the baby may not have been, urinating correctly, but they do lab tests and they do different things as babies. They have, visits sometimes every couple days, then every couple weeks. So they're monitoring them very closely. And so they can see if they pick up on any issues early on. So that could have been, it depends on what was going on.
They
with
can
her.
do that when you're carrying the baby?
Yes.
Yeah, they check the baby's kidneys whenever they're carrying and make sure that there's fluid going through.
Really?
Yeah, because actually all that amniotic
Fluid is urine.
Yeah, they're swallowing and
They're
excreting and, yeah.
So you start producing urine at a very young age when you're a fetus. So all of that amniotic fluid is the urine and they swallow it and re-urinate it.
So they make sure the both kidneys are working even before the babies are born. It's pretty cool.
It's amazing what brain can do nowadays. Yeah.
I'm through.
Anybody else?
Well, thank you so much for allowing us to do this.
Good job.
We appreciate it.
And take those home to your families. Everyone can learn about you.
Yeah, tell one of your family members, like something you learned today about UTIs, and maybe you can help them
Help you.
decide if maybe they have the signs or symptoms sometimes.
And prevention. Always
Yes,
prevent it from
prevention.
happening in the first place.
Okay.
So great. Sometimes they get UTIs at the nursing home, they go.
Yeah.
They go
Yeah.
crazy.
Yeah.
Like Miss Mildred woke up this morning and started beating up people, but she never done that before. UTIs will make you.
Yes.
Yeah.
It'll upset your whole body.
Thanks, guys.